Hello everybody, it's been about 3 months since my fourth prolotherapy treatment. So I started this in January and it is now middle November. So this has been a really long time. So over the basically a year, I've had 4 treatments and things are improving each time. Uh, where things stand now, I haven't really seen that much improvement lately, but there was one point in time when I really wanted to crack my neck. What I would do is I'd put like a cross ball somewhere on my back, and then in a certain place on my back, and then I would like crack it like that. And um, probably about 3 weeks in to this fourth, recovering from the fourth treatment, I was trying to do that, and it just I could feel it. I could feel the muscle stretching. I could feel it wanting to crack, but it just wouldn't. It just wouldn't crack. I wouldn't get that. Couldn't get that release. But once I stopped trying to do it, like 5 minutes later, then I realized that kind of like I'm okay. Like, and I haven't really wanted to try to do that since then. So definitely have had some improvement. Definitely, my lower back doesn't feel like it was prior to the treatment. Prior to the treatment, when I tried to do stuff like deadlifts and other things, it would really hurt my back. Even if it was just a kettlebell or like 25 pounds, it hurt. It hurt a lot more over the after the third session. It hurt more than it did even prior to that. And why, I'm not exactly sure. Maybe it's because other things were working really well, and so there's one thing that's not working well, it stuck out more. Who knows? But regardless, I'm feeling better. I'm performing better. So things are feeling really good. Feel like I'm making a lot of improvements. But with that comes a bit of a mixed emotion, because I've been trying to address this pain in my shoulder and my neck for about 5 years. I even have a blog about it, and if you want, it's in the comments or in the the description of the video. But in this blog, I've talked about pain in my hip and pain in my shoulder, and really have tried to do things to help fix my shoulder. And 5-year journey, and here we are. And I feel like I'm at the end of the journey, but the thing is that throughout this journey, I've been to points where I'm like, okay, I'm just a little bit closer, or just a little bit more, and then I have it. And I mean, that's how I feel right now, but that's how I felt for a long time. So on one hand, I'm like, oh my God, I'm so close to this side feeling like this side, which would be amazing. And that's on one hand. On the other hand, I'm like, if somebody was to if you have followed this from the get-go 5 years ago, then you'd be like, really, Adam? Like, you say that a lot. I don't want to be the little boy that cries wolf, but I feel like I'm right there to being like almost 100% fixed. Like, just don't have the issues anymore. I'm not in pain all the time, stuff like that. And I mean, I don't know, that it's that hope that has kept me going throughout these 5 years. I mean, if you told me that, oh, by the way, it's going to take you about 6 years to figure everything out and everything, I'd be like, maybe I'll just be sedentary and fat for the rest of my life. But no, thankfully, I keep the positive attitude, and I keep focusing on where I'm going and not where I'm at, which is keep improving. So yeah, I've decided to have a 5th treatment in December. I always said that I would be comfortable giving myself about a year to have this issue addressed, and that's about where we're at. Honestly, I think if I had to, especially if it's just for, like, say, the capsule, like, all the muscles are fine, it's just I can tell that there's still a hole in my shoulder capsule. If everything else is fine after this past treatment, except for the capsule. I am fine continuing, like with a sixth treatment, I guess. That might be where I draw the line. I'm not sure. Concerning my hip, it doesn't really hurt anymore to raise my knee to my chest. It definitely feels better. I think with my sprinting mechanics, I'm raising my right knee as high as I'm raising my left knee. My left adductors are really starting to become more active, and I think that's because I'm not having anterior pelvic tilt like I used to. I'm not having anterior pelvic tilt like I used to because the muscles in my back are starting to relax because they're being healthy. I still have some pain in my hip and kind of more the pectineus, more the groin area, rather than like where the rectus femoris is, like just on top of the high part of the quad. So I'm gonna have that checked out. Gonna try and get my most bang for my buck while I'm there to see Dr. Fullerton. Get all 3 hours of his time, and that's really where I'm at. Hopefully, for a Christmas present, Santa will give me a brand new, or a fully pain-free body. That is what I've been striving for since probably around 2000, honestly since about 2007. So I guess that'd be 7 years. So yeah, hopefully we're coming to an end, folks. I don't know if this will happen. I'm going to see if it is, but a friend of mine, she blew out her ACL, was told it was a complete tear, and but she's like, still really functional. And I kind of mentioned that to Dr. Fullerton in passing, and he said, oh, well, sometimes if the ACL, like, tears away, that's a complete tear, obviously. But sometimes, if the tendon looks more like Swiss cheese, like if there's just a whole bunch of tears within the tendon, they'll say that's a complete tear. And if it's a like sliced down the middle type tear, he wouldn't be able to help her. But if it's a Swiss cheese, then that tendon that has that lattice for the growth factors and everything to fill that in and to create a new tendon. So I was like, oh, okay, that's interesting. So I mentioned it to her, and she actually ended up going to see Dr. Fullerton. That was the case. Her ACL looks like Swiss cheese. And then a few weeks later, she went and got a treatment. So my whole point with that is that I don't know if she's up for it, but I might ask her to come on and talk about her experiences, because I have been told by a doctor that women's ACL injuries, for whatever reason, the way their legs work a little differently than men's, and one of the differences is that the ACL tear just doesn't seem to ever fully recover. I've had a couple female friends who've had 3 or 4 tears of the same ACL. Surgery repair just obviously doesn't seem to be the cure. So if my friend is up for sharing her story, I will see if I can get it on here. So anyway, this is Adam, 90% there, signing off.